These are some common scenarios where you may need to draw an ABG. Depending on where you work, you may actually have a standing order or protocol for when you need to draw an ABG. Or this may look like you communicating with the provider and the provider saying, hey, let's go ahead and get an ABG. So these are some very common reasons why we draw ABGs on patients. The first thing is ventilator or respiratory management. Maybe your patient's on a ventilator and we need to tweak some of their ventilator settings, and so we get an ABG to see where the patient's at. Maybe your patient is suddenly short of breath or suddenly hypoxic, indicating that something's going on respiratory wise to where we would want to get an ABG. Now, again, this may be a standing order where it says, like, hey, if your patient is hypoxic, get an ABG. Or maybe it's part of your rapid response care set for your rapid response nurses. Or again, this may be you going to the provider saying, hey, my patient's hypoxic, they're short of breath, and the provider saying, let's go ahead and get an ABG. Altered mental status is another really big reason why we draw ABGs. And as you've gathered by going through the different types of ABGs and the signs and symptoms, one of the biggest symptoms of all the different types of ABGs is altered mental status, being disoriented, being lethargic, being confused, being restless. And so a lot of times we grab that ABG just to see, hey, is there anything off? Like, let's just get this quick ABG. Is there anything off number wise to indicate why this patient may be altered? It's also very common in sepsis and DKA to draw ABGs to see where that patient's pH is at. Another reason we draw ABGs is because we are trending something. Maybe your patient has Q6 ABGs because we are monitoring their pH or monitoring their CO2 or their bicarb. And the last kind of main reason why we draw an ABG is your patient is on some sort of therapy like CRT, ECMO, some of these big therapies that are very common, especially in the critical care ICU setting, will require more frequent ABGs to make sure that we are running these therapies appropriately and optimizing things for that patient.